Please stay tuned for important safety information in this segment. Summer travel season is in full swing with Labor Day right around the corner. But if you have overactive bladder, or OAB, trips of any length can be a constant source of anxiety. And our next viewer can relate.
My name is Diane, and about 3 years ago, I started experiencing symptoms of overactive bladder. And after seeing my doctor, I was diagnosed with OAB. I would go to the restroom quite often and hardly anything would come out. But then, after this urgent, gotta go feeling, I'd leak without even realizing it. I was getting up in the middle of the night to urinate, and if I didn't make it in time, I'd be sneaking to change underwear and not wake my husband. It was embarrassing. Daytime isn't much better. Now, if I go anywhere, I wear menstrual pads and I try not to drink anything. I just got back from a trip to Egypt. Picture a long flight and the desert. Not exactly the place you want to be dealing with symptoms of OAB. And next up is Europe. Are there any other options to help me manage my OAB symptoms so I don't spend this trip worrying about going to the bathroom all of the time?
Diane, we hear you. And joining me now is Dr. Alexandra Rogers, urologist and spokesperson for Urovant Sciences, to talk about potential options to help manage OAB. Dr. Rogers, welcome to the doctors.
Thank you, Dr. Orden, for having me today. So excited to be here.
Dr. Rogers, Diane isn't alone. How common is overactive bladder?
Overactive bladder symptoms impact an estimated 33 million Americans, both women and men. While it can affect anyone, certain populations are at a higher risk. African American and Hispanic people have a higher prevalence of OAB. And while OAB is not uncommon, many people with symptoms delay seeking help from their doctors because they think it's just a normal part of aging and there's no treatment. But you are not alone. It is not necessarily a normal part of aging, and you don't have to suffer in silence. There are ways you can manage OAB symptoms.
One OAB symptom I think people are familiar with is that constant gotta go feeling of urgency. Dr. Rogers, tell us, what other symptoms can a person experience?
People with this condition may also experience urge urinary incontinence, where urine just leaks out from the bladder uncontrollably, meaning you leak urine and you cannot stop it at all. Other symptoms can include the frequent need to urinate, usually 8 or more times in 24 hours, making you feel like you're just always running to the restroom. And finally, people with OAB often feel a sense of urgency, meaning that sudden need to urinate even when the bladder isn't full.
Well, Diane called it out. Travel is a concern for people with OAB. What are your thoughts on this, Dr. Alex?
Many people with OAB may avoid long road trips and plane rides or experience extreme anxiety when thinking about visiting new cities where they don't know where they will find a bathroom. But the good news is there are ways to manage OAB symptoms.
Yes, I've heard that many doctors recommend pelvic floor exercises, also known as Kegels, that may help postpone the emptying of the bladder. Also using disposable or washable incontinence underwear for longer trips as possible options to managing OAB. Also try reducing bladder irritants before or during a trip and mindfully plan your rest stops ahead of time. Dr. Rogers, can you help physiologically break down what's happening with an overactive bladder?
The kidneys produce urine, which drains into your bladder. And as it gets full, nerves signal your brain to trigger the need to go to the bathroom. But with an overactive bladder, the bladder muscles contract involuntarily, even when urine is low. And this creates an urgency to urinate, and there's not an ability to postpone the need.
Dr. Rogers, explain some of the common causes of OAB.
There are several things that may cause OAB, including weak pelvic muscles, nerve damage, and certain medications. The risk also increases if you've had a stroke or have Parkinson's or Alzheimer's disease.
It's also important to be proactive. You should maintain a healthy weight, as being overweight can add pressure to your bladder. Monitor your diet. Try to avoid such things as alcohol, caffeine, spicy foods, smoking, and chocolate. And make sure to drink fluids. People often drink fewer liquids to urinate less often, but drinking less can cause you to produce more concentrated and dark urine. Concentrated urine can cause more frequent urination. So, Dr. Rogers, what other treatment options are available?
You should talk to your doctor or healthcare professional to determine what is right for you. There are several effective ways to help manage OAB symptoms. I like to recommend Gemtesa to my patients. It's a prescription medication approved by the FDA for the treatment of OAB in adults with symptoms of urge urinary incontinence, urgency, and frequency. Gemtesa is designed to help relax your bladder muscles so it can hold more urine, reducing the need to run to the restroom and the number of leakages you may experience.
And what results have been seen with this medication, Doc?
In clinical trials, significant reductions were seen in urgency, frequency, and urge urinary incontinence at 12 weeks for patients taking Gemtesa versus a sugar pill.
Dr. Rogers, are there any things to watch out for?
You should not take this medication if you have a known allergic reaction to Gemtesa or any of its ingredients. Tell your doctor right away if you're unable to empty your bladder or you have a weak urine stream. Tell your doctor if you're taking medicines that contain digoxin or if you have liver or kidney problems.
Dr. Rogers, are there any known side effects we should be aware of?
Side effects may include headache, common cold symptoms, diarrhea, nausea, urinary tract, and upper respiratory tract infection.
Dr. Rogers, it's been a pleasure having you here to share this information with our viewers.
Thank you so much for having me today.
And Diane, I hope this information helps, and have a great trip.